Imagine a scene. A man mysteriously collapses in a bustling city square. The cause of his sudden demise? Unknown. A wave of questions floods the minds of bystanders, and a veil of mystery shrouds the situation. Was it a heart attack, an undiagnosed disease, or perhaps something more sinister? In such perplexing scenarios, a special kind of detective steps in to unveil the truth. This professional is not your typical crime scene investigator you'd see in a Hollywood flick. No, this detective operates in a realm where science meets mystery, where medicine intersects with investigation. This is the realm of a pathologist. A pathologist is an essential figure in the medical world, tasked with the responsibility of determining the cause of death in such puzzling instances. They pick up where the mystery starts, deciphering the language of the body post-mortem, and connecting the dots that lead to the ultimate revelation of the truth. Enter the pathologist, the detective of the medical world. A pathologist is a medical detective, uncovering the truth hidden within the human body. As medical professionals, pathologists are experts in studying the body's tissues and fluids, helping to diagnose disease and determine its progression. They're the unseen heroes in the medical world, working behind the scenes in laboratories, examining samples under microscopes and conducting autopsies. An autopsy, often a critical part of a pathologist's work, involves a thorough examination of a decedent's body to identify the cause and manner of death. Pathologists are meticulous, their eyes trained to spot the smallest anomalies that could hold the key to solving the mystery of death. Their role extends beyond the deceased, as they also play a crucial part in diagnosing living patients, analyzing biopsies and other specimens to identify diseases like cancer. Pathologists are the bridge between the lab and the clinic, translating findings into information that clinicians can use to guide treatment. Their work is a blend of scientific analysis and investigative prowess. The first step in determining the cause of death is the autopsy. This is a systematic examination of the body, a meticulous process where every detail counts. The pathologist, a detective of sorts, begins their investigation, not with a magnifying glass, but with a scalpel. This is not a process for the faint of heart, but it is a necessary one. The autopsy starts with an external examination. Here, the pathologist inspects the outside of the body for any signs of disease or injury. They look for any anomalies like scars, rashes, or wounds, anything that could provide a clue to the cause of death. Next comes the internal examination. This is where the scalpel truly comes into play. The pathologist makes careful incisions to open up the body, revealing the internal organs. Each organ is then examined in turn. They are weighed, measured, and inspected for any abnormalities. The pathologist is like a seasoned traveler, navigating the complex terrain of the human body. The heart, lungs, liver, kidneys, all are scrutinized in this search for answers. The pathologist checks for signs of disease, such as tumors or infections. They look for any injuries, like broken bones or internal bleeding. The process is thorough, leaving no stone unturned. Sometimes the pathologist may need to take samples for further analysis. This could be a piece of tissue, a swab of fluid, or a segment of bone. These samples are then sent to the lab for testing. The results of these tests can often provide valuable insights into the cause of death. But an autopsy is not simply a physical examination. It also involves a review of the person's medical history and circumstances surrounding their death. This information, combined with the findings from the autopsy, helps the pathologist piece together the puzzle of what led to the person's demise. The autopsy is a journey into the innermost secrets of the human body. It is a process that requires a keen eye, a steady hand, and a discerning mind. It is a testament to the pathologist's dedication to uncovering the truth, no matter how elusive it may be. The autopsy can reveal secrets the body kept in life. After the autopsy, the pathologist turns to their best friend, the microscope. This humble piece of equipment is a pathologist's secret weapon, a silent partner in their quest to determine the cause of death. In the microscopic world, cells tell stories. They reveal secrets about diseases, injuries, and even the lifestyle of the deceased. By examining tissue samples under the microscope, a pathologist can detect abnormalities that might have contributed to or directly caused the death. Consider this. A healthy lung tissue under the microscope would appear as a delicate lacework of air sacs or alveoli, enabling efficient oxygen exchange. But if a pathologist observes scarred and thickened walls of these alveoli, it could indicate a condition like pulmonary fibrosis, a potential cause of death. Similarly, the microscopic examination of the heart can reveal conditions like myocardial infarction, where the heart muscle cells are replaced by fibrous tissue due to lack of oxygen. But the microscope doesn't just reveal physical changes. Sometimes the cause of death is invisible to the naked eye, hidden in the chemical makeup of the body. This is where toxicology tests come into play. They help the pathologist uncover the presence of drugs or poisons that may have been in the system at the time of death. Imagine a scenario where a seemingly healthy individual suddenly passes away. An autopsy might not reveal any physical anomalies, leaving the cause of death a mystery. However, a toxicology test could reveal the presence of a lethal dose of a drug, providing the missing piece of the puzzle. While the process might seem straightforward, it requires a keen eye, extensive knowledge, and a lot of patience. Each slide examined under the microscope is like a chapter in a book, and it's up to the pathologist to piece together these chapters into a comprehensive narrative. So, the microscope, in the hands of a pathologist, becomes a powerful tool, a window into the unseen world that holds the answers to life's most profound mysteries. Indeed, in the pursuit of truth, a closer look can uncover the unseen. After careful examination and analysis, it's time to unveil the truth. The pathologist, having delved into the mysteries of the human body, now emerges with vital answers. The final report, a document of truth, is the culmination of this meticulous investigation. The report starts with the cause of death. This isn't just a simple statement, but a comprehensive explanation. The primary cause of death is identified, followed by contributing factors. For instance, if the primary cause is a heart attack, contributing factors might include hypertension or diabetes. Every detail matters in this in-depth analysis. Next comes the manner of death. This is categorized into 5 possibilities: natural, accident, suicide, homicide, and undetermined. The pathologist's findings guide this determination. For instance, the presence of a lethal amount of a drug could suggest suicide, while specific injuries might point to an accident or even a homicide. But the report doesn't end there. It also includes significant findings not directly related to the cause of death. If our pathologist discovers an undiagnosed disease such as cancer, it's included in the report. This information can be crucial for the deceased's family, alerting them to potential genetic health risks. Creating this report is an intricate process. The pathologist must accurately interpret the evidence and translate it into a coherent and comprehensive document. It's a task that requires a keen eye, a sharp mind, and a deep understanding of the human body and its myriad ways of functioning and failing. Remember, this report is not just a document but a narrative. It's a story that explains how a person's life ended. It's a crucial tool in the pursuit of justice, providing critical evidence in legal proceedings. And in the realm of public health, it can reveal patterns and trends that help prevent future deaths. The pathologist's report, thus, is not just an end, it's a beginning too, a starting point for understanding, for justice, and for prevention. The pathologist's report is the final piece of the puzzle. The pathologists don't just solve mysteries, they serve justice and protect public health. Diving into their pivotal role in justice, pathologists are often the unsung heroes in courtrooms. They provide crucial evidence that can make or break a case. By determining the exact cause of death, they can confirm or refute claims made by the prosecution or defense. For instance, in a suspected poisoning case, a pathologist can confirm the presence of toxins, or in a possible murder case, they can determine if the injuries align with the alleged incident. Their findings are not just statements, they are indisputable scientific facts that uphold the integrity of the legal system. Beyond the courtroom, the role of pathologists extends to the broader sphere of public health. Their work doesn't stop at identifying the cause of death. They dig deeper, looking for patterns, connections, and underlying causes. When a sudden spike in lung disease occurs in a particular area, pathologists can identify if there's a common thread like asbestos exposure. They're like detectives, not just for individuals, but for entire communities and populations. In the face of a public health crisis such as a pandemic, pathologists are on the front lines. They study how the disease affects the body, helping to develop treatments and preventive measures. They are also instrumental in tracking the progression of diseases, contributing to our overall understanding and ability to combat them. Moreover, pathologists play a key role in medical research. By studying diseases and their effects on the body, they're able to contribute to the development of new treatments and cures. From understanding cancer at a cellular level to studying the impact of genetic disorders, pathologists' insights are invaluable. Their work, though often behind the scenes, shapes the course of medical practice, influences public health policies, and ultimately saves lives. They are the silent warriors, constantly fighting against disease and death, and striving for a healthier world. So the next time you hear about a mysterious case, remember the pathologist, the unsung hero of the medical world.